Friend, I am Dr. Mohammed Shuddin, MSCOO7 version. Welcome to medical science class. As a student of medical science, I wanted to take flavor every branch of medical science. What kind of things say do that is bad, that is knowledge, that is this, and that is good work, that is an art. As a Muslim, Allah is the one and only key to accept Allah, location, last and best perform. And medical science, you know that medical science by Dostap. For my patient, 22 literature syllabus. Ya Ali Lam Lam Allah Shafi Allah Mafi Allah Kafi. As a Dr. Mohammed Shuddin, MSCOO7 version, Dr. Swell, my medical science royalty 1 lakh taka per patient. Medical science, in case of medical chemistry 10 lakh taka, Bangladesh taka money. And medical chemistry 10 lakh taka, Bangladesh taka. Medical physics 1 crore taka Bangladesh royalty. Dr. Mohammed Shuddin, A to Z version. Dr. Swell. You call me Dr. Swell. Thank you very much, my friend and supporter. Medical physics. For lab physics, lab chemistry, yes. Lab physics, lab chemistry 10 lakh, lab chemistry, lab physics 1 crore royalty. Okay, fine. Ya Alif Lam Lam, Ya Quddus Ya Allah Abdul Quddus Ya Wadud Ya Allah Abdul Wadud. Ya Alif Lam Lam. Now my friend and supporter Dr. Mohammed Shuddin, MSCOO7 version Swell. Dr. Swell. What is science? Science is anything, any matter, any event, any problem, any occurrence can solve by logic, document, data, mathematics, calculation, improvement with experiment. That is science. What is medical science? Medical science is the branch of science, education, and medical science is the branch of science describe elaborated about question like human, Homo sapiens, or human. Scientific name of human, Homo sapiens. Now we discover about forever youth life, forever life, youth, and forever wealth, forever health, forever wealth. In case of medical science. Now medical science for my patient symptom, you know that how you know that your body is are good or not, good, bad, ugly. You have the pulse, adult pulse, range of adult pulse remaining in 60 to 100 for my patient, and 60 to 100 remaining 60 to 100, and average or not, and average 70 beat per minute or not, and respiratory rate 16 to 18 breath per minute or not, and there is any urination clear or not, the color of urine normal or not, color of stool normal or not, and no hatching, no coughing, no fever, range of temperature, see that temperature remain 98.6 degree Fahrenheit or not, that range adult. Then if temperature, pulse rate, temperature 98.6 degree Fahrenheit, and pulse remaining 70 beat per minute, and breath rate 16 breath per minute, urination is clear, stool is color is normal, no pain, no coughing, no hissing. Then you see there as usually your body, and the looks is good, not ill looking, and your body function is work. You can easily do your work. No need other help. Then you know that your body function are good and healthy, and continue that as long as possible. And in case of medical science, you know that for my patient, if you go to the any doctor, the reason, you know that first you see that doctor, in case of what is the diagnosis in your, what is the diagnosis and what is the treatment protocol. First you see that without examination can diagnose or not. It is tough to without examination diagnosis and disease. Then routine examination. In case of routine examination, CBC with ESR, CBC complete blood count with ESR, then RBS, random blood sugar, ECG, electroencephalography, then chest X-ray, then urine routine examination, RME, routine microscopic examination of urine. That is the routine examination for all patients. And equal more or less 80% disease can be diagnosis by routine examination. That examination, 80% disease, those are doctor give that routine examination. This routine examination, 80% disease is diagnosed. So those are my patient. You go to the doctor first without routine examination can diagnose or not. If routine examination diagnose, then what is the treatment protocol? First counseling advice, then diagnosis, counseling advice, correct or not. Then the diagnosis. If diagnosis is one disease, one drug is enough. If diagnosis more than one, then two drug. Diagnosis three drug. Diagnosis four drug. You know that. What is the reason? In case of someone give the antibiotic to proton pump inhibitor with antibiotic. You know that if you give the proton pump inhibitor in case of with antibiotic, that is not fair. In case of antibiotic, is there any medical book have antibiotic with proton pump inhibitor? If you give the proton pump inhibitor with the antibiotic, what happens? Those antibiotic work in 7 days, that go to the 10 or 14 days. The proton pump inhibitor, the patient had no ulcer, no PUD, peptic ulcer disease, not ulcer, no gastritis. So if you give proton pump inhibitor, what happens? Those drugs work in 7 days, they go to the 10 or 20 days. The proton pump inhibitor, what do? The proton pump inhibitor reduce the your HCl secretion. If reduce the HCl secretion, your stomach is normal, no ulcer, gastritis, no PUD. What happens? The dark absorption from the blood, the drugs, those are you know that the drugs, those are dissociated or those are breakdown in stomach. What happens? Reduce. The efficacy of drug also reduce. If absorption is reduced, efficacy of drug also reduce. You need more drug to take. But in this case of NSAID, non-steroid anti-inflammatory drug, that in case of that, if you take NSAID, then you should have, with NSAID you take proton pump inhibitor. If you not take NSAID, not take proton pump inhibitor, then you had NSAID induced gastric ulcer. If you NSAID, non-steroid anti-inflammatory drug, you cordially taken without proton pump inhibitor, equal more or less 1 week, then chance of arise as NSAID induced peptic ulcer disease. That is the reason with antibiotic not. But if you take NSAID, with NSAID you take proton pump inhibitor. Otherwise proton pump inhibitor in gastritis, peptic ulcer disease or other disease. Gastritis, peptic ulcer disease indication. If any patient have gastritis, then you can prescribe proton pump inhibitor. Otherwise not. So somebody occasionally give the antiviral with no gastritis, no peptic ulcer, proton pump inhibitor. Common mistake. somebody say that is the reason the drug efficacy or drug absorption reduce. Also, those drug work at 7 days, they go to the 10-14 days. The common mistake drug. Thank you very much, my friend. Support to design of medical science class. I am Dr. Mohammad Shujudi, MSCOO7 version. My Bangladesh Medical Dental Council registration number 75,995. 75,995 Bangladesh Medical and Dental Council registration number. I complete graduation from Holy Family Red Crescent. Dr. Mohammad Shujudi complete graduation from Holy Family Red Crescent Medical College, irregular course, equal more or less 10 years. I am representative of Dr. Mohammad Shujudi, MSc 007 Soel. Dr. Soel. Thank you very much, my friend. Support to Louisiana from medical science class. Today is an up from medical science class. We describe elaborated about one by one. Next class. Today is an up. Thank you very much.